Hello, everyone. Thank you so much for joining tonight. I'm really quite excited to see so many familiar faces here today. I just wanted to thank you so much for joining today and taking the time to listen to all the amazing work that has happened on the Health and Care project. And just thank you for every single contribution that you've made. Just to let you know that this event is being recorded. But that only the speakers in the plenary will be visible. So if you, for whatever reason, are not comfortable with this, just make sure to keep your camera off and we'll make sure that you're not visible in any videos. So I just wanted to say a big thank you to the speakers for tonight. You'll get to hear from Nick Downs, Miriam Levine, Francis Elliott, Sir Norman Lamb, and Julian McCrae. I'll take a moment to introduce them right before they speak. And I just also wanted to take a moment to thank my colleagues, Alistair and Hassan, that are on the call as well. If you need any form of support with your tech, just make sure to message them directly or any of us, and we'll make sure to help you as fast as we can. So tonight we will have a very quick networking activity, and you'll get to hear about a project update from Miriam, Julian, Nick, and Francis. We'll also have Sir Norman Lamb join us tonight to speak about the importance of involving people in policymaking. And then we'll have a second activity to let you express how you felt being part of this health and care project. Then we'll round up by talking about next steps and then let you get back to your evening. So many of you are familiar with the process of how we will make change happen, but we thought it might be helpful to have a very quick reminder. So let's go through each step very quickly now. After several large polls over several years, it was clear that the area that people in the UK were most concerned with was how we could make sure that everyone could get the health and social care that they need. So we brought together people from across Scotland, England, and Wales. Over 715 people came together in 101 conversations to share the experiences about how they felt, what they felt was working in health and social care, and what they thought needed to improve. We then invited the conversation hosts back to make sure that we understood correctly what their groups were saying. And together they identified 7 themes. Just before I go into the 7 themes, if you are part of the community conversations or you were part of it, give us a thumbs up, do an emoji reaction, give us a big wave, whatever you feel is most comfortable for you. So some of the themes that came up from the community conversations is, of course, an extreme pride in the NHS and the gratitude for the good care and health services that we receive. But they also realize that it's overstretched and a disconnected system. There is discrimination in secondary care, being neglected or dismissed, and people also felt that they were failing to get the right support at the right time. A lot of people felt like they were falling through the cracks and that that limited resources were leading to poor care. A lot of these stories are on our Health and Care Matters Hub, and you can listen to hundreds of experiences on the Health and Care Matters Hub, which I will share a link with you in an email as soon as possible. So we then took these conversations and the 7 themes and shared them with the People's Panel. The People's Panel is a group of 100 individuals that is representative of Scotland, England, and Wales. So the People's Panel really worked quite hard. So if you're from the People's Panel, give us a wave, an emoji, whatever feels good for you. And the People's Panel spent over 50 hours together over 12 sessions. They heard from 95 speakers and had support from 44 facilitators and support team members. Together, they identified 3 priority areas for Engage Britain to take forward into the next stage of work. So their top priority is how do we recruit, train, and retain enough social care staff to meet current and future demand. Their second priority is how we can improve communication between the NHS and people. The third most important priority is how we can recruit enough NHS staff to meet current and future demand. And later tonight, my colleagues will give you an update on how everything is going. But I thought it would be great if I could just highlight some of the very hard work that a lot of these groups did here today. So for the top priority on social care staffing crisis, we brought together over 50 participants in 6 working groups. They spent over 40 hours together debating 380 ideas. Some of these ideas came from the very people in this room tonight. Together, they chose 27 ideas that they thought were the most important. We brought these together into a set of solutions that we've been sharing with politicians, and I will make sure to share these with you in an email soon. Then, in order to better understand how communication between the NHS and people could improve, we brought together over 45 participants in 3 working groups. They spent over 15 hours together so far. They have identified 18 ideas for change, and I will make sure to share these with you in an email as well. So, just before we move on to the activity, I just thought that I would mention that later tonight, Julian McCrae, our director, will tell you more about how we are trying to make sure that the NHS has enough staff. But for now, let's talk about the activity. So in just a moment, we will put you into breakout rooms. You will be in a group, but there will not be a facilitator this time. If you run into any trouble, you can use the chat function to message Nick, Hassan, Alistair, or myself. We will keep an eye on the chat and join the room if anyone runs into any issues. So we ask that during this time, you introduce yourselves, you mention where you're joining from tonight, what part of the project you were involved in, and share a moment of your involvement in the Health and Care project that you thought really stood out to you. So you'll have 5 minutes. So we ask that you be brief and make sure that you give everyone a chance to speak. When we return from the activity, you will be hearing from our exciting speakers. So don't forget that we are here. If you need help, just message us in the chat or ask someone in your breakout room to help you message us if you don't have access to the chat function. So see you in just a few minutes. And Nick, if you wouldn't mind opening up the breakout rooms. So, okay. Well, welcome back. We hope that you enjoyed the first activity and got an opportunity to meet new people. We know that the time was a bit short, but don't worry, there'll be an activity later where we'll be able to give you more time to interact and get to know each other. So now I would like to introduce Miriam Levine. She is Engage Britain's Health and Care Program Director and leads on the Health and Care project. Miriam will be sharing more information about the ideas for change to help our country resolve the social care staffing crisis. So Miriam, I'm just going to over to you.
Awesome, thank you. I just want to say before I get started, kind of sharing back the ideas from the group that came up with these ideas, it's just really, really brilliant to see so many people here tonight. Like so many people look very, very familiar. And it's just, I find it absolutely wonderful that you've all been on this journey with us. Some people for like up to 2 years and some people more recently, but it's just fantastic, like to see so many familiar faces. But I was just going to give just a little bit more information just to bring everybody who wasn't part of this particular part of the process kind of up to speed on what our amazing kind of participants did to come up with ideas for how to fix the social care staffing crisis. So we had about 18 people who were part of our social care change group, and the kind of the weight of trying to answer this really, really massive question was on their shoulders. They were an amazing bunch of people. I know there's several of them are in this room today, which is absolutely amazing. They were people who draw on care, frontline workers, care providers, people who commission and are directors of adult social services, and policy experts. And the work they did over 6 months to come up with these ideas was actually, it's frankly huge, because this is a knotty question that has been like, it has not been grasped and has not been fixed by political parties for decades. Supporting them, as Patty said earlier, we had the social care ideas group. We had 3 groups of people, one group of people who draw on social care, one for frontline workers, one for care providers. And they met twice during this process to really support and add in their ideas to the social care change group and to feed back on the social care change group's ideas. And we had other people as well who kind of shared their ideas and their feedback online, so as many people as possible could take part in this whole process. But what I'm going to do now is just share some of the top line kind of ideas that the social care change group kind of ended up with through this long co-design process. I'm not going to go into huge amounts of detail on all of it. We will be sharing the link of the whole policy package. So if you want to read more detail, it's all online. So you can see everything that this group did. Overall, though, this is kind of the statement that they came to. Britain needs more and better care. There are not enough people working in care, and we don't value those staff that we do have enough. And what they then put together was a whole package of ideas for how to recruit, train, and retain more staff. Some of those, as you'll see, are kind of quick wins, things that could happen relatively quickly and cheaply, like straight off the bat, and some are much bigger, much more long-term kind of changes, structural changes that the group wanted to see. So the first area that they looked at, won't surprise anybody, about paying people properly, fair and standardised pay. And the group basically put this first and foremost, that unless we're paying care workers like a decent wage, the whole system isn't going to work as well as it should do. And what they were really keen to make sure is that care workers' pay was aligned with NHS. So if you're doing work that is the same or equivalent to NHS staff, you should be paid the same wages. And they also wanted to see an independent pay review board set up, a bit like they have at the NHS. So this is something that could be standardised across the whole country. The group talked a lot about valuing care workers, just really recognising how important care workers are to this whole process. And in order to do that, all the benefits that care workers get need to be overhauled, because many care workers don't get any benefits and some only get some. And they want to see this again standardised so everybody has the same benefits, like proper sick pay, holiday pay, travel time. And one thing that this process came up with, which was like an amazing and incredibly inspiring idea, was the idea of having a green badge for care workers, particularly for care workers who go into people's homes and support them, kind of people in their own homes. Care workers have to spend far too much time and money sorting out their parking, which means they're not having time with the people they're taking care of. So they suggested, why don't you have a green badge, like the blue badge for people with disabilities, so they can park for free outside people's homes, which really shows how society values that work and that job and the job that they do. The group also said that care workers need more emotional and psychological support, but also that they want a new professional body. Like, this is a profession that is not very rarely treated with that sense of professionalism, and they wanted a body who could advocate for them and kind of make that case, both for better pay and for better kind of support for the sector. And this is something I wanted to talk about. I wanted to bring us back to kind of what we've actually managed to achieve. And this is a real celebratory moment. So that idea that I mentioned before about the green badge, we've been talking to a lot of people about that idea, and I know Francis is going to come and talk about this kind of shortly, but the feedback we've had from across the board has been absolutely superb. It's like, that's such a great and obvious idea. So you say, it's like, yeah, why doesn't that exist? That's amazing. And we were really, really pleased to say that kind of the Labour Party have picked up on it and said, yeah, we'll consider that. That's a really strong idea. And they've said that publicly. So we had this headline in the Daily Mirror a few weeks ago, just to show that they really are taking seriously these ideas that participants like you have come up with. Another area that the group talked a lot about was around training and progression. So the main thing here was that what the group were talking about was that not everybody learns best or does best like under kind of exam conditions or taking qualifications or formal education. So it's really important to recognise the experience that people have, and just being a care worker for a number of years, that you bring so much expertise and value to that work. You should get paid and show career progression just by having been in the job for a decent amount of time or a long amount of time. People want to see a national training framework, and making sure that when you do get training or more qualifications or more experience, that you can carry that between jobs. And that people really need support for that training. It needs to be taken seriously. It's a really important step for care providers to take. We also spent a lot of time talking about a vocation to care. Because what people talked about, it's not just about we need more people who are care workers, it's not just about the numbers, but it's about bringing people into the sector who really care, who really kind of want to be there for the right reasons because they provide the best care for the people who need it most. So we talked a lot about how do you bring those people in? How do you make sure we get the right people kind of doing that really important job? So there's a process called values-based recruitment, which is about bringing in those people who hold the values of caring for people. We talked a lot about targeting younger people, like how do we make this something that people consider as a career? So going through to like Duke of Edinburgh schemes or National Citizen Service. And the group also talked about, can you change immigration rules so that we can make it easier for people to come in from other countries? Because at the moment it's incredibly difficult to come in as a care worker, and it's very hard for care providers to bring people in. And lastly, again, not going to surprise anybody to know that people talked about we need long-term reform, we need decent money in the sector, we need statutory guidance, which is kind of work coming out of the government. It's not necessarily laws or legislation, but it's basically guidance for local authorities and guidance for providers to say, this is what the benefit should look like, or this is what the pay scale should look like. And lastly, people wanted the government to think about this stuff really seriously for the long term. So a 10-year plan, which is that we can hold the government to account for, to look at it and go, this is your plan, this is what you've committed to, and this is what we want to see actually carried forward for the long term. Last thing I want to do is just let you know what's happening next on this bit of the work. So we're taking some of the ideas that came through this process kind of back to kind of wider members of the public, really just to find out what's the best way of talking about this stuff that gets people really interested and excited and feeling like, actually, social care, this is really important. This is something we want the government to focus on. What's the way that we can talk about it that makes people kind of think this is like kind of push it up the agenda a bit? So we're looking at different ways of talking about social care reform, and we're testing that with members of the public, absolutely based on kind of the work that came out of that group. So we know that when we go and talk to politicians about it, we can say to them, look, if you want to put this stuff into practice, if you want to pick this up, if you talk about it like this, you'll get people on side with you because they really care about it when you talk about it like this. And that's it. I just wanted to one thing, just to say a huge thank you. This is really on all of you to have kind of done all of this work. None of this has happened without you. I just think you're absolutely fantastic.
Thank you so much, Miriam. I know I'm not alone when I say that we are super excited to see how this continues to develop. So I would now like to introduce Julian McCrae. Julian is Engage Britain's director. He has been part of Engage Britain from day one. He will be sharing more information on how we are working to make sure that the NHS has enough staff to meet current and future demands. So Julian, over to you.
Great, thanks, thanks, Patty. Really appreciate that. And for those who are on the panel, and indeed some others here, may know John Hall, who was our advisor on that. I am the poor substitute for John, who unfortunately has come down with a rather bad lurgy and possibly COVID in the last 24 hours. So I hope he'll be better soon. But look, I just wanted to talk about what I think came through in all the work we've done throughout our time around health and care, that really we need the workforce there. If you want to shorten waiting lists, if you want to work with hospitals to get them treating more people, et cetera, you need the professional healthcare staff there. And this is one of those subjects which is not a surprise. Public agree with this. Actually, every professional analyst of this will point out the large amount of vacancies that are happening and growing throughout our system, and the knock-on effects of that. People may have seen in the news the other day that trusts were paying several £1,000s for doctors' time on shift because there aren't enough doctors. So suddenly it generates this instability, it generates these huge pay pressures knocking about in the system, cost pressures in the system. So look, that's all there. The other thing, of course, though, that we've been watching over the last month or two, longer, is just the incentives on our politicians to try and make sure that there are enough people in our hospitals and they can work. And we've seen that with ambulance queues outside hospitals and terrible things that are happening throughout the country. So the question, of course, is, well, what do we do about this? And there are two things that we've been working on. We've been working with the King's Fund. Some of you might know them. They're one of the big health research charities. And we pulled together a piece of work that was trying to answer this question: why, if the public agrees the policy analysis agrees, and the politicians have huge incentives to train enough doctors, nurses, etc. in the country. Why doesn't it happen? And what can we do to sort that out? Now, some of those ideas that have come out of this aren't new. They just need another push. And we've been quite fortunate to be working with someone called Bill Morgan, who people won't know, won't have heard of, unless you read a very particular newspaper article in recent weeks. But Bill is someone who's worked around health systems and politics for quite some time. And his view aligns with, actually, I'm sure Norman will join in this when he talks a little bit later. The key thing we need to do is take some of the decisions about training out of the short term, whether that's the political short term, where the incentive is always to sort out the problem now, not to invest in training enough people to sort out the problems in the future, or indeed sometimes the administrative short term, where running something, you cut back on the training budgets just to get you over the next time. And that's something that's been knocking about for a little while. Got a real push. We worked with the King's Fund on just thinking about how to take these decisions out of politics. We took that back to People's Panel and some people here, just to check that that was the right way to go. That worked, and I think it was pretty close to unanimous that this was the type of direction it needed to go in. The sort of fortuitous thing playing forward is Bill has just taken up, Miriam was talking a little bit about how Labour are taking up quite a few of the social care ideas. It'll take us a little while longer, but working very closely there. Bill has just started his number 10 health advisor for the Conservative government. So working right at the heart of that. And also in the meantime, in that slightly crazy period a few months ago, Jeremy Hunt, who we've talked to a bit about a lot of this, who was running the health committee in Parliament, has become Chancellor. So is currently committed to the Treasury to producing independent plans for workforce and sticking to those. And what we're doing at the moment is just working a little bit behind the scenes with Bill and others, just to make sure that that's as strong as it can be. So that when people say they're going to be independent plans, they're going to be scrutinized, they're going to be invested in, it actually happens. So that's one of those things that could really change a lot of things that happen in the system. The second part of that is immigration. Short run, as many people will know, the NHS has always relied on immigration and tends to be the only place you can find. Training takes a long time, so bringing in people into the country. The panel had a discussion on this, a really, really fascinating discussion. I think it was something like 80% of people, and we know this in polling as well, were agreeing that, look, if you can find short run schemes that really work to bring in people who can help deal with the shortages in the NHS, people are behind that. But I think we also heard from Bill talking about that and how we should face up to the fact that migration is something we're going to do long term. But also we had other speakers arguing the opposite, as it were, that actually we had to rely on training people ourselves. We couldn't use immigration as a long run stopgap. It wasn't fair on other countries. It wasn't fair on people who wanted to be involved in this country. And I think it was fascinating in that just where we got to, some of those arguments had real traction with people, but still a majority of people on the panel thought that, look, we should just be facing up to the fact that we're using immigration as part of how we've recruited to the NHS going forward. We're doing, Miriam's talked about this, we're really interested not just in what the panel thought, but what does the great British public think? So we're just testing that out at the moment in some work we've got in the field, just to see and really to help politicians think about the space they've got in this. What does the public really, what are the public's views on it? What solutions might be there? What would you have to show that you were doing if you wanted this to be something that wasn't exploiting people from overseas? And equally, what would we have to be able to show for how we were training people in our own country to take on these roles? So that's something that we're exploring at the moment around the workforce issues. But as I say, I am genuinely confident that that independent workforce planning will come into being, partly through some of the slightly odd changes in personnel around the Treasury, but secondly, in the, just the weight of the arguments that we've been able to add to and bring a set of public voice into about how important this is for people themselves, people around this country, how it's something that we can all unite around. So that's where we're up to there. I'm sure Francis may pick up on a couple of other points around this, but that's what we're doing on the workforce front. Thank you all.
Thank you so much, Julian. I'm very much looking forward to seeing how this continues to develop, and I appreciate you being here today to kind of let us know more about this work in John and Bill's absence. So I would now like to introduce Nick Downs, who joined Engage Britain over the summer. And Nick is Engage Britain's senior analyst. Nick will be telling us about our work on how we can help improve communication between NHS and people. So Nick, whenever you're ready.
Hello, thank you so much, Patty. I'm going to speak very briefly, so I can just pass over to you so you can hear from Francis to hear about what we've been doing to kind of get this work even further, and then also Norman Lamb. So I'll speak very briefly, but this is, as we said, our third and final area of work that we've been looking into, and it's all about improving communications in the NHS. I've got kind of 3 key points that I want to make on it. So the first is, why it's such an interesting topic. So we chose it obviously because it came out of the People's Panel, like all the other topics, but it's a really interesting one because it's never an issue that has really grabbed any headlines. It's not like A&E waiting times. It's not like not enough nurses, not enough doctors, people really failing to get those appointments. However, it is something which really does affect a wide number of people. Most people do have an experience of having poor communications in the NHS. So that might be a delayed appointment, it might be a missed appointment, not getting a referral letter, it might be going along to an appointment and having to retell your story for the 17th time because the NHS isn't very well connected up. So even though it might not be grabbing attention in the headlines, it's something which affects everyone and causes quite a lot of preventable harm. We did an exercise where we reached out on the internet, on social media, and asked people to send us their stories of these impacts, and really quite terrible and harrowing stories of people caused quite a lot of significant harm from fairly straightforward problems around communication. So first point, it's a really interesting one, and something which doesn't get enough attention, and it was really great, and I don't think a process would have necessarily highlighted this as an issue unless it was coming from the public. So a really good kind of reason, again, that why it's good to start with the public and patients when selecting the issues to look into. So that's one thing I'd say on it. The second is, so what we did is we went and gathered case studies of where this is already happening, where there's already great examples of good communication in the NHS. We didn't want to start from anything. We knew that there were going to be pockets of excellence everywhere. So we went and found those, and then we presented them back to people in this room, actually. So members of our People's Panel and other groups as well, either patients or people who work in the system, to really identify which of these case studies, which of these already working examples really answer some of those biggest challenges that people had identified. And they came up with a few great examples and stuff that they thought, yes, you Engage Britain should go away and talk about this more and think about how these can be more widely kind of used across the system. And so that's things like kind of a more integrated and better app, making sure that people can have all the information that they need all in one place. Another was helping people navigate the system a bit easier, so having someone in a GP practice potentially, or to help people find access to different services. And then the third and final one, which was a real emphasis, was this idea of a care coordinator. So for those small number of people who have lots of kind of health conditions or multiple health conditions, and they see lots of doctors, lots of nurses, lots of specialists all over the place, and they often have problems having to repeat their story again and again, or they have problems about not knowing who to talk to about a specific issue, or getting a referral letter lost. Giving them one kind of real key point of contact who can do a lot of that work for them, so they're not having to be the ones running around and doing it. And that's something, as I say, it's already happening in some places in the NHS. It was something in our groups where people said, yes, this seems like an excellent idea, it should be happening more. So again, really great work from all the people who've been involved in this process to really identify those big problems and then look through these case studies and say, yes, these are the great ones that we want to see more throughout the NHS. Which leads us just onto the third point I wanted to make, which is what's happening next on this topic. And I think we are now at Engage Britain looking into two key things. So one is, how can we talk about this issue to make it more interesting, to make it more sexy, to make it something that people care about making change in, because it is so vitally important that we do. So we're going to be doing some work looking at how you talk about it. So you're not talking about care navigators, care coordinators, all this stuff which can sound quite confusing and not very important, even though we know getting this stuff right is vitally important. So it's stuff about language and how we talk about it. But then also the other thing is about understanding what's already working in these great case studies and how can we spread them throughout the NHS? What do we need to change or incentivize to make some of those changes? So we've already got from this group really great ideas that we need to work on. And now the next step is understanding how can we spread them further. I promise to keep it short, so I'll stop there and move on to, I think, Patty, I think you're going to introduce our next speaker.
Yes, thank you so much, Nick. I really appreciate you explaining that to us and giving us a better understanding. So in a very small, quick change, we're going to move on to Sir Norman Lamb, and I would just like to introduce him first. So Sir Norman Lamb was the Liberal Democrat MP for North Norfolk from 2001 to 2019, and was the chair of the Science and Technology Select Committee from 2017 to 2019. Sir Norman Lamb was also the Minister of State of Care and Support from 2012 to 2015. He is currently chair of the South London and Maudsley NHS Foundation Trust. Norman has been a long-time campaigner for better social care and mental health, and is known for his ability to work across party lines. Some of you would have heard him speak at the People's Panel last year. It is a great honor to have you here today. And whenever you're ready, sir, over to you.
Thank you very much indeed, Patty. And it's great to be back because I feel I was there at the start of this great endeavour, and a really worthwhile one it is too. Listening to Nick just now, it really struck a chord about what he was saying on communication, and it affects all of us. My wife Mary has been trying to get medication sorted out for her 91-year-old mother-in-law, and left waiting I think 90 minutes on the phone for the GP surgery in a little market town in Suffolk. And you're just left thinking, well, if that 90-year-old was on her own and didn't have a daughter fighting for her, what would she do? She would be stranded without help. She can't wait for that long on the phone. So these issues are really important and affect all of us. I wanted to just thank you for the work that you've been doing. This is really worthwhile. It's important. Reflecting on where we're at with the state of the NHS and the care system, I think we're in a pretty bad position. You heard in the introduction that I chair a mental health trust in London, and I can tell you that the pressure on the front line in both mental health but also in acute hospitals and in general practice is acute now, and that means of course that staff are left stressed and anxious and exhausted. Too many of those staff are leaving because they feel that they can't cope any longer. They don't also feel necessarily sufficiently wanted. There's the whole issue about their level of pay and the fact that with the inflation rates that we've got now, their rate of pay is going down in real terms. So, and they can generally get better pay elsewhere. So there is a massive issue here with workforce. And if you then think about the impact on patients, on all of us, it's really disturbing. People waiting too long for cancer diagnosis and treatment, that inevitably affects your chances of survival and recovery. People waiting too long, for example, for mental health appointments. I think about 15-year-olds who in many parts of the country are waiting up to a year, sometimes even more than a year. And having experienced that in our family, I can tell you just how anxious it is for parents left waiting with nothing they can do but wait in fear that their child is deteriorating. And then if you look at the social care system, too many people are just routinely failed, can't get the care that they need, particularly vulnerable elderly people, but also younger disabled people. There are now, it's said, well over 1 million people across the country who aren't getting the care that they need. So this is a significant challenge that we face as a society. I end up feeling that still as a relatively wealthy country and economy, this is not rocket science. And the work that you're doing in coming up with solutions is absolutely critical. We need governments to engage with processes like yours. It's good, it's great to hear that already you are having some influence. You're having influence in terms of workforce planning, and great to see Wes Streeting, the Labour Shadow Health Secretary, endorsing your brilliant idea of a green badge. It's that sort of thing that just makes the life of a domiciliary care worker going from house to house so much easier. And surely we should be making their lives easier, along with paying them in a way that shows proper respect for the work that they do. I also incidentally love the idea of using the Duke of Edinburgh Award as a means of encouraging young people to go into the care sector. And I think there are opportunities for schemes like the Duke of Edinburgh Award for older people as well. There are so many people in retirement who are fit and healthy and who want to get engaged with things, and the opportunity to give back to society, to support older people and others with disabilities in their communities, in their locality, could be a really exciting opportunity. But I suppose my main point I come back to is that your work in thinking through practical solutions, particularly focusing on workforce, because that is so central to everything. Your work is exactly what we need. I'm grateful to you for sticking with this process through to this point. I hope very much that it can continue, and that governments and opposition parties will take up your ideas, and then we can see them implemented in government. But engaging with people in the way that your panel has done is exactly what we should be doing and what government needs to embrace. Thanks very much indeed, all of you.
Thank you so much for coming to speak and share your reflections today, Sir Norman. I know I'm not alone in saying that it is very exciting to hear someone like yourself to say that you're excited about the work that we're doing. So thank you so much for being here tonight.
Great pleasure.
And now we'll go over to Francis Elliott. Francis Elliott is our Director of Advocacy. He's just going to give us a quick update of some of the other work that's happening on the advocacy front. And I know we're all quite excited to hear this. So over to you, Francis.
Thanks, Patty, thanks. Well, I'm really not going to speak for very long, not least because everybody else has stolen my thunder quite a few times. And anyway, I think we're overrunning. But for those of you who don't know, I'm Francis Elliott, I'm Director of Advocacy. I get the, I don't know, pleasant or unpleasant job of interfacing with politicians and actually making sure that all the work that you do and that we do actually lands there. Because if none of this stuff is taken into, isn't implemented, we're all wasting our time. But the really good news is, as you've seen, we're not wasting our time, because we have kind of taken one pretty much all the way across. I'm very, very confident that the green badge will get implemented by either a future Labour government or indeed this government. It's a great idea, and it's a great idea that proves without doubt that this is an idea that would not have emerged in the way that it did with the force behind it without the involvement of people. So we feel we've got a really good proof point, and there are others coming through. What else to say? So it's not just about that. It's what I love about the package that you came up with and the ideas for change is that it encompasses everything from really, really large chunky stuff that's going to take a long time to get there through to kind of, you know, the smaller stuff that you can do immediately. And I know that in my conversations with, for instance, Liz Kendall, who's the Shadow Care Minister, she's excited to try and, you know, sketch out some waymarks along the way. The Labour government in Wales is already doing something very similar to this, and we're helping inform what they're doing. So that's exciting. I think we have some conversation with Scotland a bit further away to engage with our kind of Scottish colleagues, but we certainly want to do that, and we're getting there. And you know, it's not just governments, it is some of the big care providers are really interested in what we're doing. It's in their commercial interest to retain or retain their staff and recruit more. So, you know, we can disseminate this in other ways. It doesn't have to be all through government. Obviously, you know, when we started this health and care project, we had a fair idea that it was a massive issue and it was going to get bigger. I don't think any of us really realised how big and how acute the problems are. It's never felt more important. That's what I would say. And let me just be yet another person saying thank you. But yeah, thank you. That's it. I'm actually only going to speak briefly on the
I do really appreciate that, Francis, and we'll continue to share updates about the progress that's made in emails. So, but for now, we want to make sure that we give everyone an opportunity to kind of interact with each other and get to know each other. Of course, we did overrun a little bit, so the time is going to be a bit shorter, and we're trying to make the breakout rooms as small as possible to make sure that everyone gets a chance to speak. So we will put you in breakout rooms, and as before, you will not have a facilitator. So if you run into any trouble, you can use the chat function to message Nick, Hassan, Alistair, or myself. We will keep an eye on the chat to join the room if anyone runs into any issues. So as you're unlikely to be in the same breakout room that you were before, we just ask everyone to introduce themselves by saying your name, where you're joining from today, and what stages of the health and care project you're involved in. Now, we want you to take a moment to think about if you could choose just one word or two that you feel expresses how it felt being part of this project. This could be happy, hopeful, or any other word that you feel represents how you feel about taking part in the health and care project. When we return from the activity, we will be asking everyone to share their word in the chat. As some of you might not have access to the chat, please check in with each other in the breakout room to see if anyone will need support to put their word in the chat for them when we return. So originally we were going to have until 7:55, but what I'll do is I'll bring us back 2 minutes to the hour and try to wrap up much faster than I had originally planned. So don't forget that we're here if you need support, and just message us in the chat if you need anything from us. So see you in just a few minutes. So thank you so much, everyone, for joining the activities and participating. We do hope everyone got a chance to speak, and we really apologize if anyone did not. We are running short on time, and we'll make sure to keep that in mind for the next event. So if everyone's ready, we would love it if everyone could just add their word in the chat. So as we see those come in, I just want to take another moment to thank all my colleagues and speakers for helping us with tonight's event. A special shout out to Alistair and Hassan for joining on tech support, and to Francis, Miriam, Nick, and Julian for coming to speak. I also just want to thank basically everyone and just let people know that alongside advocacy, and as Nick and Miriam mentioned, we're in the testing phase. So in the testing phase, we are ensuring that our policies meet the challenges that were set by you and that they are practical to implement. So I will continue to share updates on how the Health and Care project continues to progress, and I will make sure to share opportunities to stay involved alongside this via emails. So just make sure that you always keep an eye out for my emails. And again, thank you so much for everyone that was able to join tonight, and we hope that you have a very lovely festive season. And good night and goodbye for now.